Therapist amputee specialist, and I'm here with 30 Days Live for Limb Loss Awareness Month. Today is day 4, and we're going to talk a little bit about how an amputation is performed. Now, I've got to give you a fair warning. I will be talking about surgical procedures and limbs being removed. So if you have a delicate stomach, you might want to stay tuned for tomorrow's session instead. Now, what most people are interested to learn is that surgical technique for amputation hasn't changed a whole lot in the past couple of centuries. That's right, you heard correctly. And here's why I know this. I've recently had the opportunity to go to St. Augustine, Florida. St. Augustine is the very first city to be settled in the United States by the French, the Spaniards. Everybody was in St. Augustine at one point or another. One of my favorite places to visit there is the Spanish Military Hospital Museum. I have Spanish background and as a clinician, so it's a double whammy for me. Now, when I went to the Spanish Military Hospital, the guide and the tour guides there were explaining about the surgical procedures most often used in the 1700s when the Spaniards were occupying St. Augustine. And you can probably already guess what was their most common surgical procedure: amputation, right? So what was really interesting to me was when they explained how the surgeons back then would do it, it's pretty much the same way it's done now. Okay, so basically the whole point of an amputation procedure is to remove dead or what we call necrotic tissue, right? So if a person has an infection, if a person has trauma that is causing the tissues to die, a surgeon will remove the limb up to the point where there's healthy tissue. And the goal is to preserve as much of the limb as possible. So typically what they would do is they would apply a tourniquet of sorts to the individual to prevent the person from bleeding out. Then they would use a specialized curved hook knife to make an incision around the skin. They were careful to make sure that they left enough skin there to be able to close the wound later, which is similar to what we do in our current procedures. After this, they would cut through the soft tissue, such as the fat tissue, the muscles, and the tendons. And at this time, they would also cut through the nerves. Now, basically, the way they would do that is they would gently pull the nerve, cut it, and then push it back into the tissue. After this, they would transect the bone using a bone saw. Now, oftentimes, they would try to bevel the bone and try to soften the edges so that when the closure would happen, that bone wouldn't poke through. Again, very similar to some of the surgical techniques we use nowadays. Now, once the limb was completely removed, the surgeon would use cautery devices to stop the bleeding in all the different areas, and after which they would bring the skin flap, close it. And the Spaniards learned that instead of using sutures, they would use this specialized paste on the wound and then wrap it. Okay. And they learned, actually, they were pretty ahead for their time. They were learning that if they used this technique, they had a lower risk of infection than compared to using sutures. So guys, the biggest difference between surgical techniques back then and now is anesthesia. Back then, they really didn't have any of the anesthesias available. They only had things like laudanum available, and that could just kind of put the person into a stupor. So back then, these surgeons could perform a major limb amputation in under 6 minutes, which is fairly impressive. And the reason for this is obviously they wanted to get this limb off as soon as possible to prevent the person from going into shock and dying from shock from the pain. Nowadays, we do take a little more time to do that amputation as we have the luxury of having things like general anesthesia and better pain medications available during the actual procedure itself. But the surgical procedure is done very similarly. A tourniquet effect is applied. They cut through skin, soft tissue, eventually bone. They shape the bone. What has advanced in recent years is how we treat that nerve ending, okay? And we're going to talk a little bit more about that this month as to why we've created special surgical techniques on how to treat the nerve ending to prevent problems down the line for our amputee and prosthetic wearers. All right, guys, so this was day 4 of 30 Days Live for Limb Loss Awareness Month. Please help spread the word. And this show today is meant for not only for my amputee viewers, but also for my non-amputee viewers so that you can learn a little bit more about what I do with this beautiful population. All right, guys, I'll see you guys tomorrow for day 5.